So my name is Edmond Zhou. I work with the Ministry of Health in Singapore. I have two portfolios. One of them is in future systems and innovation. So that's why I'm here with all this interesting technology and how to introduce them into the ecosystem. And my other portfolio is really in infrastructure. So that's the brick and mortar, where I build the hospitals, polyclinics, and so on. Right.
Yeah.
So very interesting and divergent portfolio, but at the same time it overlaps because it's really about how you codify good innovations, cost-effective ones, and then build it into the template so that the future infrastructure that we have can incorporate all these interesting things.
Yeah, super cool. I love to learn more about the healthcare needs and capability in Singapore. That's your remit is Singapore, right?
Yeah.
Yeah. And so from my understanding, it would be it's such an interesting area to look at given the diverse nature of the individuals that might be there, expatriates, but also the native requirements. So tell me more about the healthcare requirements within Singapore.
I think in terms of requirement, we are, as in the population that we serve is indeed quite diverse. One of the key challenges, and I think it's similar here, is that Singapore is aging. We will become a super aged society pretty soon. So a lot of it is really thinking about how we can better take care of, better engage the seniors. So that's one big aspect. The other aspect is also really in terms of the young, because of the whole devices, the whole digital environment. Kids today, they are digital natives and they are very, very good with all the devices. I mean, as a parent myself, I am guilty that I do give the devices to my kids sometimes, maybe too much, but I think this is where the tension is also for us. Parents, how should we strike the balance between good exposure, but at the same time within the healthy limits? And for the grandparents, the elderly, right? How do we engage them? One of the key movements that we had that started about 2-3 years ago, I think roughly about 2 years ago, was this thing called Healthier SG. It is basically a relationship that we want to build between an individual and his or her physician. So family doctor.
Yes.
So the whole idea is that they will not only be visiting the doctor for episodic care, it is really more about the entire care continuum. Before you are even sick, I start talking to you about your health plan, your care plan, what would make you continue as a healthy individual, what you can do, and how to keep yourself engaged and feel empowered that this is your health that you are taking care of.
Yeah. Yeah.
So that whole relationship is important. So when we extend that to the elderly, we are also we have this program called as Age Well SG. The whole idea is to activate the seniors, especially the younger seniors, to then engage and take care of the older seniors. So that is also interesting in the sense that we make them volunteers. We hope to encourage them to volunteer with us. And that engagement helps both ways because they are then socially involved. We think a lot of the issue is to do with disconnecting from the society, being at home, being alone. So if they can join community events, join basically social gatherings of individuals that are like themselves, that's helpful.
Yeah, I love that idea of the role of community in health generally. Like healthcare and wellness goes much beyond just the measuring biomarkers or taking medication or the basic the interaction of humans play such an important role in that, and for various reasons. And so I imagine you're because I saw you're on stages at Digital Health Festival. Is that what you're sharing with some of the attendees here today?
Yes. So I was talking to a lot about the environment, the context of Singapore, and at the same time how we want to use technology, especially those that are in the consumer realm, as well as a mix of the medical devices, to better deliver care, in a sense that we are trying to bring the care to the individual. I think for a lot of places, the whole context is that I go to a family physician for certain episodes. I go to the hospital for if I need or require a certain level of care. So what we are trying to do is to break down that physical limitation to have premises neutral care such that we can bring the care to the individual and all the care surrounding the individual is no longer limited by physical constraints. So in order to do that, as a concept, it's important to first have the vision, but we also have all the different levers that we need to enable in order to have that delivery done. For example, we change our regulations. Now we have this new act that really regulates providers by the services that they provide, as opposed to, because you're running a hospital, I give you a hospital license. So that is a major change. And the financing itself would also follow the care delivery, rather than in the past, it was more of, if an individual stayed in a hospital, he or she is eligible for a certain level of subsidies.
Yeah.
Now we change that. So even if you go on a hospital at home sort of arrangement, that level of subsidy, that level of financing follows. So to create that whole environment is going to take a very concerted effort across the whole ecosystem. I think government has an important role to play. So we have been putting in place the regulatory, the financing, as well as the technology sort of infrastructure, including data protection, data sharing, to allow greater trust in the kind of digital infrastructure that we are building.
Yeah. I could be wrong with this assumption here, but I'm just super curious, so I'm going to ask. Often people look at, and I'll frame it up in that, often people look at Australia from other parts of the world and think this is a good health system for us to perhaps demonstrate the potential of a piece of technology or a new innovation or even an innovative model of care, because we've got a decent sized population, but it's not ginormous. It's 23 million people, or 24. We have a pretty diverse population. And so the theory is you might be able to scale that out to other parts, but it's quite a finite total addressable market. If I think about Singapore, and in the same way, it's kind of a nice size in that you can demonstrate something. You've got somewhat of, it's not an unwieldy amount of people, it's controllable. But then because I'd love to learn more about, I guess, the broader Asia region, Asia Pacific, and how much does other parts of the region kind of look at what Singapore's doing to then apply into other parts? Or is it Singapore is quite unique in what it does compared to other parts of the region?
I don't think we are unique in the sense that the challenges that we face is shared across many different jurisdictions.
Yeah.
So on that front, I think that we can do a lot of cross-learning. And in terms of contributions, I think Singapore can also contribute in a way that is similar to what you just mentioned, how Australia intends to contribute as well. So we do think that we have a fairly diverse population as well.
Yeah.
And in terms of profile, I think we are a lot more Asian-based, so Polynesian, Chinese.
Yeah.
It's a good mix of different race, but at the same time culture, which is important because a lot of, how should I put it, a lot of these factors that affect health goes beyond the genetics, goes beyond the race, right? It is also how you live your life.
Yeah.
So that sort of dynamics, I thought is something that Singapore can help. And like you say, we do have a nice population, about I think 5 to 6 million now.
Yeah.
And we have a pretty established electronic medical record system. So that sort of health and longitudinal data we do have. Then the tricky part is in terms of how to enable it for research, but at the same time protect the privacy of individual, as in the necessary data protection that we have. So those are ways that we think we want to contribute to and want to play in. And we are hoping that we can also increase the types and the number of clinical trials that we are running. Of course, I think our environment is more suitable for some types versus others, but we are trying to play. And I think we will be very keen to look at, research collaborations, having institutes cite certain satellite office or even their HQs within the Singapore context.
Yeah.
Those will be interesting collaborations. Yeah.